Welcome back, podcasters, to Skin the Surface. On this week's episode, Dr. Rina and I are excited to discuss a topic that we often get asked about by patients, family members, and friends who are newly engaged and want to look their best on their wedding day. From lasers to injectables, the cosmetic options are seemingly endless for brides and grooms-to-be, members of the wedding party, or even the extended family members. To help answer all of your burning cosmetic questions, we are joined today by a very special guest, board-certified cosmetic and medical dermatologist Dr. Nazanin Saedi. Dr. Saedi is the director of the Jefferson Laser Surgery and Cosmetic Center in Philadelphia. She lectures nationally and internationally on topics regarding laser surgery and cosmetic dermatology. She is an active member of many professional societies and has authored over 75 articles and book chapters. Welcome, Dr. Saedi.
Thank you so much for having me, guys.
Thank you for joining us.
Thanks for joining us.
Well, we'll go ahead and get started. So everyone wants perfect glowing skin on their wedding day, but figuring out the best timing for dermatologic procedures can be really tricky. Dr. Saedi, how far in advance should a time cosmetic patient schedule with a board-certified dermatologist to discuss procedures?
I think scheduling 6 months ahead of time is ideal. If you can schedule 9 to 12 months in advance, if you know, that would be even better.
Great. So basically, as soon as you know you're getting married, it's probably a good time to contact your dermatologist.
Exactly. The problem is that a lot of people think that the skin can be fixed last minute, or people pop in for big events wanting to have a procedure done a month in advance, and that's just not the way to go. You definitely want to come in advance so that you can come up with a plan, try some of the treatments, like if you're curious about injectables such as neuromodulators like Botox or fillers, you can try it out, see what it looks like before your wedding. So you're not waiting for everything to settle in or to get all the nuances of the treatment. So you can really finesse your treatment before your wedding.
Yeah, I think that's so important about setting expectations early on. So you started to touch on that, but depend on the type of treatment you get, kind of what the results will be and what to expect and how long it takes to get those results?
Absolutely. So we can talk about something like fillers. Like fillers, you pretty much have automatic, instant gratification. I think that's one of the best things about fillers for both the physician and the patient, because you see those instant results. But, there can be some swelling, there can be some bruising, so you don't even want to do fillers right before. But in terms of doing some laser treatments, first of all, most laser treatments, it takes a series of treatments to get the optimal results, and you continue seeing improvement even after your last treatment. So you definitely want to plan accordingly for that as well.
Great. I'm glad you touched upon fillers and lasers. I really wanted to dive into some of the specific cosmetic treatments based on specific concerns. And let's just start with facial flushing and blushing, also referred to as rosacea. And for those who recall, Dr. Mary and I had an episode focusing on the different types of medical treatments for rosacea. But Dr. Saedi, can you discuss cosmetic treatments that you recommend for those suffering with rosacea, and how far in advance from the wedding day do you start recommending the first treatment?
Sure. So I think for rosacea, it's probably good to come in about 6 months ahead of time, because you want to be able to get in a series of laser treatments and also have any side effects of those laser treatments resolve. There are many different lasers that treat vascular lesions. So vascular rosacea being one of them, the flushing and those broken capillaries. And no matter what vascular laser you choose, you'll need 3, sometimes 4 treatments to get the ideal results. And then sometimes these lasers can have some swelling associated with them. So you don't want to do that last treatment before, like right before your wedding, because you don't want to have any unnecessary swelling either.
Mm-hmm. And in addition to the laser, are there any other recommendations that you have for patients with rosacea?
Sure. I tell them to try to recognize any triggers that they have and try to minimize those triggers about 6 months ahead of time to really try to get their rosacea under control. And sometimes, if patients have problems with flushing, what I like to do is recommend, along with getting approval from their primary care physician, maybe even a low dose beta blocker to help with that flushing. I also recommend some green tinted creams or makeup because green tends to camouflage red really well.
That's a great point.
Yeah, that's a great trick. Great. So I think we kind of touched around our rosacea issues, but then kind of going into some of the other issues that bring patients to getting cosmetic procedures, commonly things like skin aging, fine lines, wrinkles, or even sun damage. So let's start with fine lines and wrinkles. Dr. Saedi, what are the different types of injectable cosmetic treatments that are available to help treat fine lines and wrinkles?
Sure. So for fine lines and wrinkles, I think especially in areas of movement, the go-to would be something like Botox or any of the other neuromodulators. What you need to know is that it takes 7 to 10 days for it to kick in to its full effect, and it lasts about 3 months. So what I like to do is to have them try Botox so that they don't get surprised by how they're going to look like in photos, and then come back 3 months later and we'll do it again and have that second visit be a month before the wedding. So the Botox is in full swing. It looks good. If we need to do a touch up at the 2 week mark, we can still do a touch up and they'll have optimal results by the wedding day.
Great, perfect. And then beyond Botox, are there any FDA approved laser devices that you'll commonly use to treat signs of skin aging, like fine lines, wrinkles, or even sun damage? And
Sure.
then can you touch on the downtime and expectations with that type of treatment?
Sure. So for fine lines and wrinkles, it really depends on how extensive they are. Sometimes I recommend non-ablative fractional resurfacing. If there is an element of sun damage as well as those, I like to use the Fraxel 1927 because it does improve fine lines, wrinkles, improve skin texture, and also help with any kind of uneven skin tone. Typically, people need 2 to 3 treatments spaced 1 month apart, and they're read for about 5 days after the treatment. I like to do the last treatment about 2 months before the wedding. So in case there's any kind of acne like breakout or any kind of breakout, the skin is totally recovered and looks flawless for the wedding day. If patients just have a little bit of fine lines and they want some textural improvement, then a more gentle treatment like the Clear and Brilliant, which is again another non-ablative fractional resurfacing, but lower energy, more gentle, would be appropriate too. And again, the similar timeline, 3 treatments or so, spaced 1 month apart, doing the last one about 2 months before the event. For just patients who have brown discoloration or just want to even out their skin tone, I like using the Pico laser. And for that, you need more treatments. I typically say 4 to 5 treatments, again in a monthly interval, but there's really no downtime. You might be pink for a day. That doesn't mean that this is a treatment you should do a week or two before your wedding, but it is something you can do a month before just to optimize the appearance of brown spots and any discoloration you have before the wedding. And for young patients, I think a treatment like IPL would be great for any kind of people who have a little bit of blotchy redness and some sunspots could benefit from a series of IPL.
Great. So seems like there's a lot of different
There's
options depending
so
on
many different
what
options.
people want. Yeah. And then, another question we often get asked is like, people often get confused about when do I use Botox? I think we kind of touched on the appropriate scenarios for Botox, but can you talk a little bit about kind of when you would think about filler and other injectables there and kind of where we can use them?
Sure. So I think people do confuse Botox and filler kind of interchangeably. So I like to explain to patients like Botox is used to relax muscles of movement, whereas with filler, we often fill in areas where there's volume loss or like we need to build a little bit more substance. And sometimes we fill lines too, such as smile lines or marionette lines. And if you do a light filler, you can often chase smile lines as well. But Botox we use for the frown lines, forehead lines, crow's feet lines. And I've been doing a lot more of Botox on the lower face for help with sharpening the jawline, and helping with any kind of pebbling on the chin. But for the most part, what I like to tell patients is that fillers fill, they replace volume loss, and Botox helps relax muscles.
Great. And then for your male patients, especially prior to the wedding day, do you have any recommendations in terms of Botox and filler for them? Is it very similar to your female patients?
It's similar to the female patients. I think the problem you run into is getting them to come in far in advance and to commit to multiple treatments. I find male patients want more of an instant gratification, whereas female patients and brides are, they have their planners out and they're ready to schedule everything with the best timing so that they look their best on wedding day.
And after someone's first injection with filler, someone who's never had filler before, what should they expect?
You can expect some swelling. You might have some bruising, and the swelling can last up to 2 weeks. And this is something that I explain to new patients, but also patients who've had fillers before. Because people tend to forget what it's like. And each time it could be a little different. These filler particles attract water, so you can definitely have swelling for up to 2 weeks. And some people have it for even longer, and that's totally normal. And then the bruising tends to go away within 2 weeks as well. So what I tell people in terms of what to expect after filler is that these temporary side effects can occur. The good news is they'll go away in about 2 weeks.
That's good.
Yeah.
Yeah, that's good to know. So in addition to the cosmetic treatments, are there any anti-aging topicals that you typically recommend that are available over the counter, and anything that could be purchased through a dermatologist such as yourself?
Yeah, sure. So the 3 topicals that I think everyone should be on is some form of vitamin C, sunscreen, and a retinoid. And I probably said it in the wrong order. So it would be sunscreen, retinoid, then vitamin C. But I think that sunscreen is the best anti-aging. It's never too late to start using it. Retinoids are so great for increasing cell turnover so your skin looks smoother. They also help with any kind of hyperpigmentation. It helps with acne. It also helps with fine lines. And then vitamin C is just an excellent antioxidant that can, again, help prevent the signs of sun damage and help with hyperpigmentation.
That's great. And then, I think we even touched on that in one of our previous podcast episodes. So tune in, listeners.
Yeah.
Plug for our own selves. But the other thing I wanted to mention and talk with you about is, so we've talked about like all these different ways that we can address different, depths or different types of sun damage in areas of aging. But, you kind of touch us on a little bit. Do you often kind of combine these procedures? Would you do more than one procedure in a visit, or do you like to space them out?
I often like to combine them as long as it's safe to combine the procedures and patients are okay having a little bit more downtime. I think sometimes combining them optimizes treatment. Also, in certain cases, you can't do them on the same day, or it's not as safe to do them on the same day. Like doing Botox and a resurfacing procedure is not ideal because the Botox could theoretically spread due to the swelling from the laser procedure. But if you do the Botox a week before, you're relaxing the muscles and you're going to get a better outcome from the resurfacing. So it depends. I do like to combine, but in certain scenarios, it's best to separate.
Great. Thank you.
Great. And just to touch upon, I know we talked about just a shift. A lot of my patients come in and they ask about acne scar treatments and hyperpigmentation. And so do you have any general recommendations from a cosmetic standpoint about any acne scar treatment? And is this dependent on the type of scarring and an individual skin type and skin coloring?
Yeah, so acne scars, I think, is its own beast altogether. That might actually be a fun podcast to do, just because it's not a one size fits all for treatment. So it depends on the type of acne scarring you have. Is it just, erythematous scars, or is it shallow boxcar scars, or deep ice pick scars? Or rolling scars. So a lot of times I like to use a combination of treatments, and they might not be on the same day. But whether it's treating with a vascular laser to get the redness out, doing laser resurfacing to help improve the skin texture, filling the scar so that that area looks lifted, or doing a strong TCA concentration. But it just depends on the kind of acne scars they have. But I think the most important thing with patients with acne scarring, which is hard to explain to brides, is that no matter what you do and how many treatments you do, the skin's not going to look the way it looked before they had acne and had these acne scars. And I think that is frustrating for patients, but especially frustrating to brides because they're so worried about how their face and the scars are going to appear in photos.
And that's a good point. I think that a lot of people are frustrated with acne scars, and so having realistic expectations is important. And that would be a great topic to discuss a little bit more in another podcast episode for sure. Are there any over-the-counter recommendations that you recommend to help reduce the appearance of acne scars or for pigmentation?
Yeah, sure. For over the counter, I really like Adapalene or Differin. A few years ago, it was a prescription strength retinoid, and now it's available at every drugstore. So I think that will definitely help with some hyperpigmentation. It'll help a little bit with the appearance of acne scars. There's also some over-the-counter hydroquinone formulations that are topical treatments, and I think that those are helpful as well for hyperpigmentation. And then vitamin C is great for hyperpigmentation as well. And there's so many different brands that have vitamin C in them. The important thing is finding out or figuring out which one will not make you break out, because some of them are not the best for acne prone skin.
Yeah, that's very true. And I often will hear from patients that they can sting and burn. So finding one that works well for, a different skin type or a different sensitivity is really important. But it's great that a lot of brands are starting to make more vitamin C products.
Right.
Every time I'm there, I feel like I see new products on the shelf. So
yeah, absolutely.
Perfect. Well, any other tips or words of wisdom for our brides and grooms to be out there?
Yeah, my biggest tip is to plan ahead, as like with the wedding. Just plan ahead, see your dermatologist, and then come up with a plan that has realistic goals and expectations and fits within your budget, and just be as honest as possible so that you guys can work together so that you can look your best on the big day.
I love it.
Awesome. Well, thank you so much. I think that's all that we have for today's episode. So we would like to give a big thanks to our wonderful guest, Dr. Saedi, for joining us and sharing all of her wisdom on cosmetic procedures for our soon-to-be brides and grooms out there. So thank you so much.
Thanks so much for having me.
Thank you.
Of course. And to our listeners, don't forget to check out our website at www.skinthesurfacepod.com to learn more and listen to past podcast episodes. And we'll see you next time, podcasters.